So another big peptide that's out in the news right now is the GLP-1s, right? And what are GLP-1s? These are the peptides that people are using to lose weight. And so studies showing about 22% body weight over a course of 6 months to a year. I mean, so this is significant. I'd say a large percentage of our country is on this. But there are some downsides to this, right? In the GLP-1 world. And one of the biggest downsides is bone density loss, which also leads to muscle loss. So the GLP-1 in particular can have effects, negative effects on our bone. And certainly we know it has negative effects on our muscles. And so you need to understand that there's a very strong connection between those two, that if you get that wrong, you're setting yourself up for a poorer outcome or longer term difficulties from the use of the GLP-1s. So you want the weight loss, you want to be able to get back to being healthy, but if you're damaging your bone densities, if you're damaging the health of the bone, I always tell people it's kind of a foundational issue for me. The healthier your bone is, and this is especially for women, the healthier your bone is, the longer you'll live, the stronger you'll be, the longer your muscles will stay healthy. And the longer we can keep muscle on our body, everybody's talking about longevity. It's all about how long muscles stick around. So once we start having muscle loss, or what we call sarcopenia, now we start to put ourselves on the negative side of longevity rather than the positive side of longevity. So if you're going to do GLP-1s, one of the simplest things to do is to start supplementing with an appropriate bone formula. So we use one that's through EBM. It's called S4, and what it is, it's a medical food and medical foods just have a higher standard in the FDA that requires a greater purity than what you would normally buy over the counter. But more importantly, there has to be medical evidence for the use of these. And so in this case, what we want to do is reestablish your bone density. You get onto these GLP-1s and you start losing density, men and women, but women more importantly, pretty quickly. And that's also why we see this rapid muscle loss, because bone is what stabilizes the muscle. The stronger your bone is, the healthier and the stronger and the more density of muscle you'll retain. And if you start losing that bony density, you have to start losing the muscle mass. And the secondary effect of that is all these critical structures, tendons and ligaments and muscle, are all attaching to the bone. So the weaker the bone is, the weaker those structures become, and then you become more at risk for injuring ligaments and tendons and having bony injuries, or weakness of the muscles that are going to cause other injuries because of lack of muscular control for the activities that you want to do. I'm a win the simple kind of guy, right? So if you are utilizing supplementation and that stabilizes the bone, that has a strong track record of showing that this can not only make bones healthy, but restore back bone health and reverse the courses of osteoporosis and osteopenia, then I would strongly encourage you get that started. Especially if you're going to be on the GLP-1s. And the second thing is, you need to be involved in a very good resistance training program. And I would encourage all of you out there, when you're looking at resistance training program, there's two types. There's concentric training, and there's what we call eccentric training. Eccentric is the resistance of the motion. Concentric is the creation of the motion. Eccentric training has a much greater profound effect on your muscles than concentric training. We get a local effect when we do it, just kind of creating the movement, the concentric. We get a global effect through multiple muscles when we do it eccentrically. And then eccentric exercises have a connection. There's a special muscle fiber in all our muscles called the titin fiber, and that has a connection in your central nervous system to your motor cortex and your cerebellum, keeping your muscles strong, keeping your muscles stable, and maintaining your muscle mass. So if you're gonna participate in the world of GLP-1s, do it well, do it safely, do it with a good practitioner who is well aware of these effects. Get on a solid bone supplement. So again, through our company, IOME Health, this is what we use. Our bone formula called S4. Strongly recommend that. And then beyond that, get into a resistance training program that is eccentrically based, that you can reestablish or maintain muscle mass at a high level. Because if you're maintaining your bone health, you're going to maintain your muscle mass, and then you're going to maintain your health long term after you come off the GLPs. The biggest issue coming off the GLP-1s, everybody gets the weight back. Why? You have no muscle mass. You lost your bone mass. You lost the big metabolic things that burn up your calories, and now they're in bad shape. And so now you have a lower metabolic rate, and it's a higher chance of regaining weight. So win the simple. Get a couple things right while you're doing this, and then enjoy the benefits without the risk.